A very good evening to everyone who's viewing Bethany TV. Welcome to the show Health and Wellness, the 13th of January 2024. Welcome to the show. My name is Dorothy Babazi, and today we'll be discussing something that everyone needs to know, that is the importance of health checkups. Why is it important to have health checkups, and why do we have to do them? In the studio, I do have Dr. Twinamasco Stephen. He's a very handsome man, as you can see. So I need all the attention to be here so that you get the information that we shall be passing for you, our viewers, to get to know and understand why is it important to have checkups. Welcome to the show, Dr. Twinamasco.
Thank you very much.
How has been the new year?
The new year is a bit hard. It's January. It has like 300 days. So we have to find a way of going through January. Then we enter February, which is also a love month. So
hey, had forgotten. Okay, Dr. Twinamasco, yes. Welcome to Bethany.
Thank you very much.
I believe it's your first time or second time?
It's my first time here.
Time.
Yes, it's a very beautiful place.
Okay.
I've enjoyed my stay for the few minutes
that
I've been around. So
we are so warm. We welcome our new doctors. It's always important to have friendly, conversations with our doctors so that we don't look strangers.
Yes.
So welcome to the show. Today we'll be talking about the importance of checkups in our daily lives. Okay. And we'll kick off with why is it important to have checkups, and if we have those checkups, what are the early detectives that we can find once we have the checkups done? Okay,
thank you very much. First and foremost, I would love to say that checkups are when, let's say, it's an occasion whereby a patient or a person in good health status will go to a hospital and they do specific tests on them because they feel a certain way or they want to prevent specific, let's say, diseases from catching up, most especially the non-communicable diseases.
Okay.
Yes, when it comes to which diseases can you get at an early age, you can get, most of the cancers can be detected early if taken into consideration. It is good that someone goes and tries to check them out, most especially when they have a history. Okay. Let's say I have a relative that has cancer, or I have, let's say, something that I'm very sure or that I've read somewhere, because we are in the information age right now. Mm-hmm. You can read somewhere and then they tell you that once you smoke a lot, you're probably going to get lung cancer. So once I go early to the hospital, I can easily detect such conditions: diabetes, cancers, hypertension, and some other conditions that are there that we may talk about early. Yes.
When you talk about non-communicable diseases, what do you mean? What are the non-communicables?
When I talk about non-communicable diseases, I necessarily mean that conditions that once I have it, it's not easy for me to give it to you. Okay, I can't give it to you, but I can pass it on to my child. You get? Because most times in the hospitals, when we are trying to rule out specific conditions that someone may be having, the easiest way to do is also one of the easiest ways. When you're taking history, you're going to ask, tata wo yaina sukari, tata wo yaina pressure, tata wo yaina that specific diseases, sickle cells. It will help to find out what it is.
Okay.
Early, yeah.
Okay. So when you talk about now that you mentioned hypertension, diabetes, cancer.
Yes, also sickle cells.
Sickle cells as well.
Yes.
Those are some of the diseases that could be detected earlier.
Yes.
Is it because they are inherited or someone?
Yes, mostly because they're inherited, but also because it is easy to get them. The tests are cheap, because now in the hospitals they use a lot of acronyms like RBS, FBG, that is random blood glucose or random blood sugars. If someone comes up randomly and then I take your sugar levels and I find they're very high, it is easy for me to say maybe you may have either just eaten, or if you ate 8 hours ago, you would probably be having diabetes.
Yes.
So I would have to keep screening more so that I find out what exactly is the problem, and it would help to detect and probably advise you on how to prevent the disease from progressing. Yeah.
So once you talk about, I've done the checkups, I've known the diseases.
Yes.
Someone would be comfortable at home and be like, I've done these checkups. But how often should one do health checkups?
For how often it is will depend on exactly who you are. That's the first thing. The second thing would be, which disease are you trying to get? So in case, let's say, I would say now that in the hospitals we have the people that we talk about, the ones that are called the immunocompromised.
Okay.
The people that probably have, let's say, like HIV, or the people that have cancer and are on immunosuppressive drugs, drugs that will lower your immunity.
Yes.
Those ones have to do regular checkups. For that I mean every month or every after
The
3
particular
months.
date that the doctor
Yes.
is giving you as
The
well.
doctor will tell you, come back at this day. Most times for people with diabetes, they'll tell you, come back after 2 months, because the medication you will be having will be for 2 months.
Yes.
So after 2 months, the doctor will have to check you out again and tell you, you know what, the sugar is okay, so go on with these medications. Or they'll tell you, your sugar levels are still high, let us try to lower them more with this other drug.
Okay.
Yes. It helps.
When we talk about regular checkups, I've seen schools.
Yes.
I'm happy for those schools that are doing that, you know, to ensure that they give us forms that we take to, you know, specific hospitals, and they specify the hospitals, because they know parents have kitu kidogo where you just find like, now I'm your friend, right? Today I'll just call Dr. Twinambas and be like, Nyamba, but as you say, that health checkups usually help us to detect earlier, you know, non-communicable diseases or diseases that could have been preventable. And I think this one is something that parents need to know. Our schools are soon opening. It shouldn't be something that we just take lightly. That it's important to have these checkups when you have children that are really young, and to help, you know, avoid those diseases in the later stage.
Yes, that is something that I've also seen. I've encountered a few parents, and I think this one I should say it in Luganda for emphasis. So when it comes, wekijja ku kintu ky'okutwala abaana ku ssomero nga tubakoze checkups, ogenda obbakebera ebintu bye babeera bawandiise bibeera bintu nga bisobola okukula omwana n'alwalira ddala ku ssomero. Ate amasomero agasinga tegalina dokita alimu balina bannansi. Most nurses are good. Bannansi balungi, bamanyi emirimu gye bakola, bakikoledde obudde. Naye ate ogenda n'okibalamu, ogenda okusanga nga ate babulamu nabo katugambe ku ddagala erimu abaana bye balina okubeera nga bakola ki? Bye balina okufuna. Kati ogenda katugambe omwana alina asthma, najja ku ssomero, talina check-up, tebamukebedde, tebalabye oba ali bulungi, talina ddagala, wabeera bubi ennyo nga essomero terina nebulizer ya kumuyamba. Omwana balina omujjawo bamutwale mu ddwaliro. And most times in let's say schools don't have ambulances, so it is hard to transport the child from head teachers. Now it will be hard for you to call the head teacher who doesn't live within the school vicinity to take the student. So it is better webakuwa akapapula ako ogende mu ddwaliro okebeze mutabani wo oba muwala wo, ugenda okumuzzayo kimanyi muwala wange namuleesa ali bulungi. Yes. Most especially now for diseases when they're rampant, like malaria, typhoid, brucella. We are from eating meat. Christmas.
Doctor, we didn't eat meat. We ate meat.
We may still be digesting right now. Naye ogenda n'okitunuulira tuvudde mu kyalo tulidde buli mmere eriyo. Kati omwana agenda kujja n'ebirwadde byonna ebivudde byonna gye bava. Right now students are coming from different parts of the country to converge in one school. That means that abana guys all the diseases have been converged. Most especially infectious diseases, malaria being on top of the list right now, and it's still a killer disease in Uganda. May I put it among, we had the 6th killer before. I still put it among one of the most rampant diseases to look at.
Recently I saw, I think on the news, Bethany TV News, where they're going to start the immunization for malaria, the vaccine. That shows how, you know, it has been deadly.
Yes.
And I'm happy, I don't know if people really did this, but Ministry of Health has really done a good job. Before the year ended, they were giving out these free mosquito nets. You'd go to a particular place where they were giving them out, and you'd get these mosquito nets because it is a killer disease.
Yes.
Very much.
That is very true. And also, abana embamba batwala ku ssomero, just saying, mubawe mosquito nets bagende nazo.
Baba mutebasa bulungi.
Mosquito net is ventilated bulungi obwo obutuli bw'olabamu
empewo eyongedde bunene ezirisobola n'okuyingira
baba kati babeera bagenze kuvuba. They've gone fishing.
We're talking about students,
Okay.
the elderly. I'm one of them. I hate health checkups. I'd be like, now this 100K, zetaga pampa, zina transport ya kuja ku Bethany nkole, amafuta nyina okuteeka mu motoka, abaana balina okulya,
school fees,
okwekolako nange,
January school fees
tugireke nze ng'omuntu. So it becomes really hard to find like someone injecting someone into just go for a health checkup. How is it important for the elderly? Now talking to kubana besomero. Ne kati omuntu ali ewaka talabanga ko ddwaliro unless ngafunye omutwe gutabuse gususe pressure tasa bulungi. I think it's also something that they should know. Yes.
Actually, I'm going to be speaking Luganda for everything that I want to emphasize. Ekintu ekyokugamba nti kansooka embeera obubi emmala ngende mu ddwaliro abamu ku mmwe mujja muli bubi nnyo nga naffe abasawo tetusobola bayamba. Ekisinga okumalamu amaanyi kiri nti bajja abamu katugambe he has known he is hypertensive.
Yes.
Ayina pressure eri waggulu nnyo naye ate kati ajja emukuba omutwe gutandika okukulumamu ng'eri mu 150. Some people are very proud of it. Some people are very proud. Hey, the pressure yange etambulira mu 150 awo. That's a very bad thing. I was viewing one of the shows that you did before with one of the doctors. Yagamba diabetic retinopathy.
Yes.
About it.
Dr. May.
Yes, Dr. May emphasized that very well to tell you that wogenda nga you're bragging around ezange zitambulira mu 150. You're not a car that you're very fast. No. It means that you're going closer to your death. I don't know how to put it, but you're taking yourself towards the grave. It's good to keep your blood pressures low because there are very many complications that come with it. Oyinza nofuna stroke. Ku 15 ezo zennyini zoyogererako, which is not good. So when you look at it, the elderly, just talking about the people, there are specific conditions that will let me first explain it like this. Omuntu omukulu wetuba tukula omubiri gwaffe gutandika okukoowa. Okukoowa ntegeeza nti it will the ability of your body to regenerate specific tissues or to heal will what? Will weaken. Yeah, that is why you see when an old person breaks a leg and a young boy breaks a leg, the young boy will get healed before the old man. Yes. So if we play around with let me say like our health, we are most likely going to die before the time reaches. Regular checkups will extend your lifespan. Let me put it like that, because you will prevent a lot of conditions. You will be taught on how to prevent them and how to live a healthier life at that age. That is a good thing about health checkups.
Okay. Well, if you've just joined us, this is Health and Wellness. Dorothy is my name. We're discussing about the importance of having regular checkups in our daily life or daily routine. Doctor, we've talked about abakadde, abaana, tubayise bonna tubogeddeko. But in that screening, bw'omanya mbu olina obulwadde bwe buti, lifestyle erina okukyuka.
Yes.
Kati lifestyle nga ki doctor? Tuzogeddeko naye we need to keep on reminding and singing about them.
Ekirala lifestyle, of course, nchuwamuzogeddeko on the shows, I'm very sure before me you have talked and you have taught, but it is not bad to re-echo something.
True.
Yeah, so wetujja ku lifestyles, tusooka ne tulowooza.
Lifestyles church.
Lifestyle engeri omuntu gy'abeeramu. Olya ki, okola ki, do you sit down and just enjoy that day, otuula n'olaba TV lunaku ne luyitawo, bwebityo. If it is that kind, you see, even us, our own bodies will show you. Katugo ogenda n'oyimirira ku weighing scale nga toli muwanvu nnyo naye n'osanga nga okuba 10.
It is alarming.
It is alarming. Yes, so one of the first things that we have to avoid right now, abantu abasinga abazadde bayagala abaana baabwe babeere ki banene.
Tulagamba abaana bali mu kulya bulungi.
Exactly. That is not good feeding.
Okay.
Yes. A very fat child is an obese child. An obese child is one that is not healthy. You see, Simanyo Valio, I don't know if you have ever done a segment on malnutrition.
Yes, a lot.
Yes, if you have, you'll know that malnutrition is not clearly that no. It's only people who are very small, lacking. No, even this scale reaches this side, they say +2 is bad. Like when you go above it, you find the child cheeks are very big. Yes, the child is at risk of getting non-communicable diseases at a very young age. So when it comes to lifestyle, we are supposed to change on how it is, because when you talk about lifestyle, Katugambe, those people who are big, obese people, they're supposed to start working out, lose the weight. Once you lose the weight, you're going to help yourself in one way. You're going to reduce the risk of getting heart diseases. You get? You're going to reduce the risk. Actually, obesity is one of the risk factors that are almost everywhere. Obesity is a risk factor for cancers, some cancers. Obesity is a risk factor for hypertension. Obesity is a risk factor for diabetes.
Okay.
Obesity is itself can be a disease to you. You cannot perform specific actions, because now for men, obesity is also a risk factor for, let's say, sexual dysfunction.
Oh, true.
Yeah.
True.
If you're a very fat man, for you, you cannot, you can die. Okay. Yes.
Now that we've talked about that, when we do screening, is there a difference between screening and checkups?
Yes, but it is one in the same. Let's say checkups are, let's say, the big picture, and then screening is like a subset, because when you go for checkup, you're probably going to get screened for specific disease.
You're getting a doctor.
You're getting a presenter. We ngamba screening ne checkups chechimu katono. Naye we ngamba checkups chechinene ka screening kabera mu makati. Kubanga wojja.
Okay.
Checkups will involve me conversing with you about almost everything.
What led you to this?
Exactly. You see? Then the next thing is I will examine you. Nja kukwata ko ndabe oba nkukebere wano ku mukono ndabe oba ogezze nnyo, kebere weight yo, kukwate ko ndabe oba aliwa wakuluma. I check, then I see. You get? Then afterwards, I will do screening tests.
Okay.
Yes, screening tests is the fasting blood glucose, then diabetes. I'll check your blood pressure to see if you're hypertensive.
Okay.
I'll screen you for cervical cancer if you're a woman. I'll check for what they call PSA, prostatic specific antigen, for men above the age of 60. I have to find out for prostate cancer.
Yes.
I'll check for specific hormone levels in your body, most especially for women who have, let's say, for women above the menopause age. Some of they're the ones who normally, because the risk keeps on increasing for cervical cancer and the others, ovarian cancer and all the other stuff. Yes. There are some specific cancers and some specific conditions that will come, and you may take it, and in the early stages, they will come and then you will not know.
True.
Things like, I bloat a lot and I'm a woman above the age of 45.
Bloating, you mean
bloating?
Bloating is
okuzimba olubuto n'owulira nga mulimu omukka mungi.
Okay, yes. Okay.
It could be an early sign for someone who's getting ovarian cancer.
Wanji?
Yes, not to scare you.
Sekulya nyombo zikusewa kulya oils.
Neda. It could be. It's one of the let's say the early symptoms that we kind of take off. I go to the toilet and I see blood. Yes, you could have fissures, but you could also have a disease within that is growing that you probably do not know about.
Okay.
You get?
Okay.
Yes. Over time, there are specific things that can come up. You get? Now, let me say, by the time you start bloating a lot in ovarian cancer, it has spread to the abdominal
abdominal area. Sorry.
Yes.
So now that as a doctor, how does it help you? I mean, you know, there are doctors who look at patients, like you watch that lady and she told me there are patients that really come and you just feel like crying. You can't tell them, hypertension, you're now blind. But as doctors, how do you feel? People usually come for checkups.
Yes, one of the disadvantages of regular checkups is that different hospitals have prices on, let's say, consultation fee and what. So, kata yo consultation fee abantu budget here. True. People, a lot of doctors right now are practicing family medicine, and
which is
atugambe he's in hospital and is going to like family mwana muto mukuluchi like that. So kati gogena niwe kwata ku muntu no gamba ono doctor agenda kubanga nkolako, so he will know like what goes on, and he will try to help you as much. So if you make friends with that one, he can actually help you around and help you, teach you how to prevent. I have a saying of myself that I got from somewhere else, which is prevention is better than cure. I got it when I was still with Fort Portal, regional referral that side. Sometimes you'd be on ward and you find a patient and it is sad. You can't do anything to reverse their condition. All you can do is keep them alive so that they can, you know, say hello. I'm being blunt. So that they can say hello or bye to their siblings or make a will. But it is inevitable.
Yeah.
You get? Someone comes with, of course, they don't have money. Because Uganda, as we know it, we have a lot of money within the country, but some people are not as fortunate as others.
Yes.
So the less fortunate out there, they should also try some checkups with their local hospitals.
Regional referrals.
Regional referrals can help.
Yeah.
But some patients will come in when he's in, let's say, the end stage of chronic kidney failure, and he's hypertensive and diabetic.
Wow.
He's at the end stage. So at the end of the day, they'll tell the patient, you go to Mulago or to Chirudu where they can do dialysis. And trust me, it is expensive to do dialysis.
I know.
And you will need it for the rest of your life.
True.
Or you will need a kidney transplant. But I've heard that I've started doing them. So
we did one.
Hey, congratulations too. But one is not enough. There are a lot of patients that actually need it. However much I'm hearing, I've seen a tweet somewhere that said, so you've done one kidney transplant. Should we start selling?
We should celebrate.
No, should we start selling our kidney?
No, it's not about selling. It's about keeping, you know, our lives in a better shape. We are still with Dr. Twina Masco-Stephen. Dorothy is my name. We shall go for a short commercial break, but we'll be back. Welcome back from that short commercial break. Bethany TV for Health is here every Saturday. We'll be having health and wellness with me, myself, Dorothy Mbabazi. And if you've just seen some of the breaks that we did have, we have Bethany Mwalimu. If you know a student who loves science, there's only one thing you should do. Make sure you watch Bethany TV every single day so that, you know, when the teacher comes in the studio, they ask you a question related to science, and trust me, you're going to win amazing goodies. Imagine having a backpack full of toilet papers, sanitary towels, stationery as well, you know, having rulers, pencils and books, so that parents, you know, that's another burden cut off. So make sure you always listen or watch to Bethany TV, which is Bethany Mwalimu, every single day, to win amazing goodies every single day. In the studio, I do have Dr. Twina Masco-Stephen, and we are talking about the importance of checkups or screening.
Yes.
You know, there are people who believe in basonye so wagama checkup so tuno kugera screening.
Checkups and screening.
And screening. So before we went for a commercial break, we're talking about the importance and how it helps you as doctors. But also, we have noticed that when people do checkups, in treatment, it also helps to determine which treatment these people, you know, have to get in the long run. As doctors, how does that also help, also as our viewers are watching?
For us, it helps in a way that if someone has been doing regular checkups, it helps in a way that they know how they have been going, like how their bodies are. You're educated about your body. So when you come and I'm explaining a specific condition that you have to you, it is easy for me to relay the information of what I want you to change and why you have to change it. So let's say a person who comes, has been getting regular checkups and they're diabetic.
Okay.
They'll be already educated about the diabetic plate. They'll be already told, they're already told about the medications they're supposed to take and how they're supposed to take them. So when I get to see this patient won't come like the one who doesn't know anything.
True.
And they'll make my job easier. So if I'm to spend 30 minutes on one patient, this patient I won't spend that much time. I will spend a very short time on them, and it will be easy for me to go on to the others. And I'll see very many patients and help very many patients in a single, let's say like in an hour, as compared to when I have to now teach you from scratch.
From scratch, very true.
Yes.
The government of Uganda is trying to beat HIV and AIDS by 2030, which is a few years from now. I may be here, I may not be here. HIV, hepatitis B,
Yes.
deadly, silent, deadly, but
Yes.
people rarely do. We have had early checkups of, I can go to the hospital, buy something, a PSA check. We have seen people who, hepatitis B is something that comes, everything has been deteriorated. So with HIV and AIDS, I think there is some more light that people need to go and check up for this virus before it's detected at the later stage.
Yes. Truth is, it is good that we have actually started like, we have taught people how to check for HIV. They know.
Your class cut.
Yes.
A plus.
It's an A plus. But
Yes.
this is the thing. You see, out there, let's say being a doctor is one thing that teaches you as you're studying to be one.
Yes.
They teach you to be as blunt as possible.
Okay.
People are misusing these screening tests. You get? And I'll tell you this. The screening tests that are used are not 100%. Yes.
Doctor.
The
That's
specificity
good.
and
It's 100%.
no, it is not. The specificity of these kits that we use may not be 100%, and it means that there's those people kanchogere mu Luganda akakantu tekasobola kugamba nti 10 ku 10 ono muntu talina sirimu, talina HIV and AIDS. Actually HIV specifically, the virus.
Yes, true.
Kubanga wegenda budget specificity tekali 100% specific okugamba nti ono this person nkakuta omusayi ngujjeko ngutadde wano nenkola ki mukagerako ngamba ono omuntu alina sirimu line bbiri tukamanyi. People know these things, but that being the fact behind everything, the fact that it cannot give you 100% guarantee that this person is HIV positive or HIV negative. The error margin, we leave out a few people. You get?
Yes.
Plus, HIV, the virus, is not detected. It's not easily detected in the first 3 months after you have what? You've contracted it.
Wanji?
Yes. It is not. It
It
will tell you.
continue with the life.
It will tell you continue with life.
But you have to go to the hospital.
Yes. And the problem that we have done, being frank, and that screening test has done is that it has told people, and people currently have used it as a tool.
To say I'm safe.
Not to say I'm safe. To justify infidelity. Let me put it like that. Like, remember when we were kids, some of us, they told us they had that thing of ABC. Abstain, be faithful, use a condom. Okay? Now, the be faithful, people are like, wenkakwatako bwe bati nensanga nga naye tayina. Let us enjoy. But I will inform people today that there are those people that will not be easily detected, but they have the virus, and you will get it.
So it's always important when you use that, what is it called?
That specific.
That's
Stat pack.
Stat pack. It's always important to go to the hospital as well.
Yes. You
because
see,
the hospital has more machines and.
Yeah, the doctors know how to move from one stage to another. You know, they have to confirm with this one, then they use another one to confirm to see if you actually have. If the two show you that you have, yes.
Okay.
If the two show you that you don't have,
well and good.
Well and good. Enjoy life.
So we shall be having some few calls, but as the producer is trying to get me those few callers, how does checkups help in someone's mental health and stress levels? Does it contribute something big in the picture in the long run?
It will, to a point. Some people are, let's say, are scared. The mental illnesses that will come up because of specific conditions. Some people will be lied to. You know, some of us have parents who will diagnose you before you actually have a condition. They'll tell you, "Chirabika goli mulwadde wa musujja gwansiri." They hold with the
just a temperature.
Then you get those bussoas for herpes, and then they'll be like, "Musujja guli mufuluma. It is okay even if you don't take." Well, that is not necessarily the guarantee, but it can help with mental health. Sometimes, you see, when you do regular checkups, you're going to be educated, not from just a single, like a line, like let's say I'm going to teach you only about diabetes. No, the way you come, what you're scared about is what I'll teach you about. Oh. So if, let's say, someone comes and I check you and I find out, let's say you're like HIV positive, or I'll have to teach you, but before I actually do teach you, you'll also have to see a counselor, which will be very important. And the fact that you've seen a counselor, when you go back home, you'll be a little bit at
relaxed,
ease.
yes.
You get, as compared to when you didn't
have any knowledge.
Yes. Oh. Some people are scared to come. Yeah. But
if you're scared,
come. If you're scared, you just go to hospital. There are professional counselors. Those people have been educated. Some of them have masters. They've been educated to make life easier for you when it comes to how you think and what you're going to do.
Okay.
Because some diseases can mess you up completely and you run mad if you do not. If you do not actually get like closure. Let me put it like that.
True. That's why they call it closure. At Bethany Hospital, located at Luzera, we do have a counselor, or is there Madame Jovia? She's the best counselor. That woman, when she tells you what she has gone through, and when she advises you, like, but you woman, how come you look beautiful, you look amazing? But counselors really play a big role. You know, doctors will say what they need to say, but for them, they don't have that consoling mood. So I think that's why we have now counselors that come in to help. There is a disease, and it's not mainly, I think, in Uganda, maybe worldwide, self-medication. You've
I even had to.
You took like some breath. Self-medication. Someone will come, Dr. Bade Priamo Mutwe, Nemreka Panado, Mutwe, Nemreka Diclofenac.
Yes.
Tuina pharmacy, Katizatu. We just go and tell when did you last this malaria? Asiman, I don't know. As a doctor, what are those challenges you're faced with, you know, people who take self-medication?
For being, actually not just doctors, the problem comes mainly for, let's say, the pharmacy department.
It's bad.
And
before you attack the pharmacist, doctor.
And
then, you know, running to the doctor, I thought they'd shake.
I'm not blaming the pharmacy department.
Okay.
I'm saying the problem. Fenga ba doctor chinzo butatuluma nnyo kiruma ba pharmacy okulaba nti ogenze mu pharmacy n'ofuna eddagala oliguze buguzi bakwadde panado omutwe gukuluma omusujja ogenda kujja mu ddwaliro. How it will affect me, it is some of the drugs that people take are going to remove some of the symptoms. Ogirabanga panado naye oba oyina malaria nomira panado omusujja, that fever will disappear because it has an antipyretic property.
Okay.
The pain, the headache will disappear because it is an analgesic.
Okay.
Ogeno kiraba omira zino zi diclofenac, they remove specific symptoms that could have helped me come to a conclusion early.
Of which disease you have? Of
specific diseases, yes. And if I don't find those, you see, some of the patients will come and I will look at them and be like, because of what I'm seeing, and when I touch you and I'm checking, I'll find that you're not that badly off. So I'll send you back home. with, you know, coartem. Let's say it's malaria with coartem because omwana yamize Panadol. Nakola ki?
Nabiandize high fever noteka kakagwe ne kukendeera.
Kati wajja mu ddwaliro. Yes, it is good to know which drug to give when. But the first problem will be some of those drugs will reduce the fever until the patient. So when the mother comes on, kirabika omusujja gukendedde yeebake tujja mutwala kumacha. But when the child is actually badly off, so by the time they come to hospital, omwana ali bubi nnyo. You get? That is the problem. Kati wetugenda mu pharmacy eri waliwo kye bayita resistance in drugs.
Okay.
Kati wetugenda ne tumira bu amoxicillin zino zijjamuzi ze tulaba ezigenda okututta zikola kizituuka ekiseera nazo ne zigamba owaayi batukubye nnyo obubomu bwa amoxicillin katufune ki a shield in layman's language. That's how it is. They mutate and they get resistance against these amoxicillin. Kati gw'ojja mu ddwaliro nze sigenda kimanya kubanga nange ndi muntu. I cannot see the germs. I cannot know what they're doing. But I'll ask you. Most doctors will ask you, what have you taken so far? And then you'll say I took amoxicillin. That's why you see our pharmacists have made drugs like the ones which will say methicillin resistant. Actually, the jam is called the methicillin resistant. It's called MRSA. It is resistant to methicillin.
Wow.
You get. So you have to get a stronger drug, which is much more expensive. You get. So it is not just impacting me and the pharmacist who doesn't have, of which our hospitals do not have that. They're not that well equipped with some of the medications, some of them.
Very true.
So in case you go and now I do not have vancomycin or I do not have drugs like imipenem, meropenem, they're going to, you will suffer. Because we shall tell you, let's say we are in the village. I like giving an example of Fort Portal. You're in Fort Portal, I'll tell you, call what?
Tourism sitting,
No. Fort Portal, I love Fort Portal because I've been there and the place is really amazing and I met some of the most amazing people. And even my teacher is now in Fort Portal.
Okay.
Yes, Dr. Makoba, wherever he is. I'm grateful.
Okay.
But being there, since I'm giving it as a distance, okay, let me give my village in Kanungu. You're in Kanungu. Osaga n'okusaga ne bagamba eddagala lyoyagala liri Kampala olaba ogenzo divuga ku basi and the bus from Kampala to Kanungu is approximately like 12 hours 9 if it is very fast.
So the hypothesis is we should have checkups.
Yes.
Dr. omutwe gunnumye era nziruke mu ddwaliro.
Omutwe gukulumye kisinziira kitutte budde ki. How is the headache? You see, we say headache, but there are different kinds of headache. There are people that will have headaches here. Just the front part of the head. Yeah. So that could be just sinuses that are being inflamed. Or stress. Or if you're hypertensive, omutwe gukuluma genda mu ddwaliro. It sounds like it's an easy thing.
It's not easy, doctor.
But depending on who you are, you will know. Headaches are not just headaches. Headache is a symptom of something. Yeah. True. We treat headaches, but headaches are not a disease. Headaches are symptoms. Okay. When someone comes, I have fever. Musuja, fever is a symptom. It is not a disease. Yes, that's the whole thing. So if we treat the fever, if we treat the headache, the disease is inside growing, but the headache is not there.
In your career, I believe you've seen types of genders that come to the hospital for checkups.
Yes.
In your view, who are those people? I really don't want to defend our gender because I know we really try to come to hospitals, but because of specific things. But I think it's a wake-up call. We have had discussions here where we talk about fathers or fathers to be always go for antenatal cares. Now also checkups, I think it should go all around. It shouldn't be only children, only women.
Yes, only.
But that they are pregnant, katugwetandika antenatal mwami tudde waka nebas.
Truth. Antenatal is supposed to be attended by both. Woba ogenze genda ne mukazi wo. Motukeyo when they're advising those women that do the ladies that do that job, the men that do that job of trying to teach, the women during antenatal visits, the doctors that are there, they have information not only for women, but also for men.
Yes.
So once you go there and you're like, that you will miss that information, which will be very crucial for you in the future. And also, we are not just supposed to go for antenatal after you get pregnant. You're supposed to go before. You'll have in Uganda, I've seen there's a trend that is going around, planned kids. Mulimba.
Doctor, we are planned kids.
You are not planned kids. A planned child is one whereby the parents actually went to hospital before they conceive.
Oh, before they conceive. Oh.
Approximately 3 months before they conceive. So that they can easily plan the pregnancy to get the best outcome of the child. You get? So that they can prevent these things that may come, the complications. And such a woman is well educated about how her pregnancy is going to go. You get? In Chidemo mu Luganda. Planned kid. Oba omwana gwe bategekedde kangambe bwe batyo. Ye mwana bazadde be nga tebannafuna lubuto oba maama we nga tannafuna lubuto basooka ne bagenda mu ddwaliro ne basooka basoma engeri y'okweyisaamu kye balina okulya kye balina okukola n'eddagala lye balina okumira nga tebannafuna lubuto. Yes.
So
that is a planned
as
child.
we wind out, what are those things that talking to checkups we need a sila? Is it like emphasizing something of why is it important? In few words, that why is it important for checkups and why we should do them?
Okay, for the importance of checkups, since you've said emphasis, let me use Uganda. Checkups, kibeera kintu wogenda mu ddwaliro n'oweekebeza ebirwadde ebiki by'osobola okuba ng'ofunye kisinzira bazadde bo baali babiina oba tebaali tebabiina. Kisinzira omubiri gwe weewulira batya owulira bulungi oba oli bubi. Ddala this message goes to men. Abasajja, men, please go for medical checkups for prostatic cancer, for other conditions, hypertension, diabetes. Kubanga we see, yes, women, congratulations, I think I can clap for you. Women have tried. Women have tried to go for checkups. Women have tried to take their children for checkups. Ekintu kya health tukiteekemu amaanyi mangi kubanga nga bw'olabye our hospitals are not well equipped for a lot of procedures. Tugenda kusindika India, tukusindike Malaysia, we send you to America, we send you to England. Nairobi. Yes, to Nairobi, actually to South Africa for medicine. But trust me, okugula ticket okugenda ngoli mulwadde, it's quite pricey. N'okutuukayo, the prices of the other people are quite very expensive, and I'm very sure insurance doesn't normally cover those things. So in case you can avoid something, it would be better to avoid it. Yes.
Thank you so much. I have some messages coming in. This one is from someone, I think they've sent it, and they says, hello, Madam Babazi, thanks for the show. Happy New Year, Merry Gets. Dr. Trina Masko, they are watching you live, that is in Gayaza. I think this person is called Rukundo. Okay. Thank you so much for watching Bethany TV. Checkups is something that everyone should do. Child, mother, father, grandparents. Buli omu agende yeekebeze. Tetugenda kulinda ng'oli bubi. Otandika okuba amasimu.
Never single men bagambeko, single ladies. Ogambye father and mother. So single men, single ladies out there who are planning on getting married, please go and check up.
It's not even getting married, it's having your life, you know, your health in check. You know, it's important to have, as you say, prevention is better.
Prevention is better than cure.
So it's important to have, you know, this checkup. So why we came up with this topic is that as the year is beginning, as we plan our goals, as we set our goals, that let's also include the checkups. It's something that we can avoid as 2024 is here. For me and the team, I would like to wish you a very beautiful weekend. But do remember, Bethany Mwalimu is here. So make sure you tune in every single day to win amazing goodies. All you have to do is listen and answer any science question that will be asked. Those are students, not Fabakulu. Nice weekend. And tomorrow is a Sunday. Make sure you go to church. For me and the team, good night.